Ladies and gentlemen, esteemed colleagues, I welcome you all to this symposium focused on the intricate marvels of the human reproductive system. As my classmates and I discuss the topics that compose this system, we will together embark on a journey exploring the realms of the reproductive system, looking into things such as its complexity, functionality, and the remarkable processes that govern it. As we delve into this topic, we unravel the mechanisms that perpetuate our species, from the intricacies of the hormones and the structural intricacies of its anatomy. We are in awe at nature's elegance. Now, before we officially begin, I would like to give an overview of this topic. So, from previous discussions, we know that an organ system is defined as a group of organs who work together to carry out a specific function. When we combine this with the root word reproduce, we get the definition that the reproductive system is a group of organs and hormone-producing glands that work together to carry out the function of reproduction. Now, further, there are 4 specific steps or functions that the reproductive system is responsible for. First, we have produce hormones. Second, produce sperm and egg cells. Third, transport and sustain these cells. And lastly, nurture the offspring. Now, these tasks are delegated among the primary and accessory glands of the reproductive system. The primary organs, also known as the gonads of the male reproductive system, is the testes, while in the female reproductive system, it is the ovaries. Now, any other gland or organ that aids in carrying out these functions but is not a gonad are known as the accessory glands. Now, I will call on Andy Arsenal to discuss these specific points.
Let us now delve into the intricacies of the male reproductive system. At the heart of this system lies the testis. The primary male sex organ is responsible for the production of the spermatozoa and the testosterone. Within the testis, seminiferous tubules play a crucial role in spermatogenesis, the process by which sperms are formed. As spermatogonia undergoes successive divisions and maturation, they transform into sperm cells, each bearing the genetic blueprint essential for fertilization. Next is the epididymis. Serves as a site for sperm maturation and storage, enhancing their motility and fertilizing capacity. Then next is the scrotum. A pouch of skin and muscle houses and protects the testes, helping to maintain their optimal temperature for sperm production. The next, the vas deferens, in turn, functions as a conduit for transferring sperm from the epididymis to the urethra, where they merge with seminal fluid produced by the seminal vesicles, prostate gland, and bulbourethral glands, which will be presented next by Erin.
Thank you, Ashley, for that introduction. Now I will be discussing the lateral organs of the male reproductive system. Okay, so first we have the vas deferens. Now, it functions as a conduit for transporting sperm from the epididymis to the urethra, where they merge with seminal fluid produced by the seminal vesicles, the prostate glands, and the bulbourethral glands. Now, in the next slides, we will be discussing these 3 glands. First, the seminal vesicles. The seminal vesicles are sac-like pouches that attach to the vas deferens near the base of the bladder. Seminal vesicles make up to 80% of male ejaculatory fluid, including fructose. Now, fructose is an energy source for sperm, and it's something that actually helps them move, also known as motility. In the next slide, we will be discussing the prostate gland. The prostate gland contributes a milky alkaline fluid, also aiding in sperm motility and neutralizing the acidic environment of the female reproductive tract. The prostate adds additional fluid to ejaculate, which helps nourish the sperm. And lastly, next step please, we have the vulvo-urethral glands. These glands secrete a clear, viscous fluid that lubricates the urethra, facilitating the passage of sperm and protecting them from being acidic residues in urine. And that is the anatomy and physiology of the male reproductive system. Now, I would like to call on Garnet Mendoza and Gregory Salante to discuss it in detail.
The testes are vital male organs within the male reproductive system responsible for the production of sperm as well as the synthesis of testosterone, a key male sex hormone. Located within the scrotum, these hair glands carry out spermatogenesis, regulate our secondary sexual characteristics such as facial hair growth, which is regulated by testosterone, and it also stores and transports mature sperm during sexual intercourse. The testes play a fundamental role in male reproductive physiology, contributing significantly to the process of sexual reproduction and the expression of male traits. Today, I will be talking about the testes, its parts, and its functions. The testes are covered by a dense fibrous layer called the tunica albuginea, which extends inward to form the septum, dividing the testes into compartments known as testicular lobes. Testicular lobes, these lobes, somewhere around 250, each contain 1 to 3 hot-rooted structures called the seminiferous tubules. Within these tubules, spermatogenesis, or the process of sperm production, takes place. The seminiferous tubules are like the two types of cells, namely the spermatogonia, which undergo meiotic division for sperm formation, and Sertoli cells, or supporting cells, which provide nutrition to the germ. Sertoli cells produce androgen binding protein, or ADP, which binds testosterone and promotes sperm production. Next slide. Next, we have interstitial spaces. Interstitial spaces contain small blood vessels and interstitial cells, also known as Leydig cells, which synthesize and secrete the male hormone testosterone. Next, we have the rectal testes, or also known as the mediastinal testes, which is a network of tubules located at the middle of the testes, where sperm from the seminiferous tubules are collected. From the rectal testes, we move on sperm loops to the vas efferentia, which are a series of small ducts that connect the rectal testes to the epididymis. The epididymis serves as a storage site for sperm and facilitates their maturation. From the epididymis, mature cells are transported into the vas deferens. Next slide, please. Mature cells are transported into the vas deferens, which is responsible for transporting the sperm from the epididymis to the ejaculatory duct. From then on, the ejaculatory duct merges with the the ejaculatory duct merges with the urethra, ultimately allowing for the expulsion of sperm during ejaculation. My fellow presenter here will be presenting the two terms, erection and ejaculation.
So the first term is erection. An erection is a hardening of the penis that occurs when sponge-like tissue inside the penis fills up with blood. Next slide, please. So here are the parts of the penis that are related for erection. The main erectile bodies in the penis are sponge-like. And first is the corpus cavernosa and the corpus spongiosum. These are the corpus cavernosa and this is the corpus spongiosum. They are the main erectile bodies in the penis that are sponge-like structures running along the length of the penis, responsible for being engorged in blood, which causes erection. And then this is the ventral artery. These two. It facilitates increased blood flow to the penis for erection and the dorsal penile valves, which are these. They compress to prohibit blood from here. So the process of back please. So the process of erection is when stimuli triggers specific areas in the brain to activate specific areas in the spinal cord, more specifically the S2, S3, and S4. To release parasympathetic neurons that go into the subsplanchnic nerves. Once the parasympathetic neurons reach the erectile tissues, they will then be activated, causing nitric oxide to be released within the corpora cavernosa and the corpus spongiosum. The nitric oxide will cause the central artery to vasodilate or open up, bringing more blood into these tissues. Next slide, please. Next is ejaculation. It is the release of sperm cells and seminal plasma from the male reproductive system. It consists of two phases, emission and expulsion. The main organs that are involved are the epididymis, the vas deferens, the seminal vesicles, the prostate, the urethra, and the bladder neck. In the emission phase, the bladder neck closes to avoid cellular fluid to enter the bladder and to avoid urine leaking out. The smooth muscle of the epididymis, the vas deferens, ejaculatory ducts, and prostate, seminal vesicles are going to contract and empty the sperm fluids into the urethra. In the expulsion phase, semen is pushed out through the rapid and rhythmic contraction of the urethral smooth muscles. That is all for ejaculation. Next will be the female reproductive system. Any questions? Yes, you go.
What is vasodilation?
Okay, so vasodilation is the widening of the arteries, or in erection, it is the widening of the central artery in the penis to increase the blood flow to the penis, which helps in erection. That's all.
Okay, thank you for listening to us for our presentation on Reproductive. We will now be moving to the presentation of the female reproductive system by Corbin John Cruz and Bernadette Ramirez.
As we were just talking about the male reproductive system, right now we are here to discuss the main functions and parts of the female reproductive system. First, we have the vagina. The vagina has three main functions. It provides a passageway for blood and mucosal tissue from the uterus to the human body during the menstrual period. It's where the penis is inserted during vaginal sex and it holds sperm until they pass into the uterus. It provides a passageway for childbirth. Now, the vagina is positioned anterior and posterior to the uterus. It serves as a passage for menstrual flow and facilitates sexual intercourse. During childbirth, it stretches laterally to accommodate the passage of the baby. Now, second, we have ovary. These are small oval-shaped glands located on either side of the uterus. There are two ovaries, one on each side of the uterus, where female hormones, estrogen and progesterone, are produced and eggs are stored to be. Every month, an egg is released. This is called ovulation. Now, in the ovary, it is positioned laterally to the uterus. It plays a key role in producing and releasing female sex hormones, such as estrogen and progesterone. Other than that, the ovaries serve as the site where immature eggs, such as oocytes, are housed and nurtured, with one egg being released monthly during ovulation for potential fertilization by sperm. Now, we have the uterus. It is an inverted, pear-shaped muscular organ of the female reproductive system. It is located between the bladder and the rectum. It functions to nourish and house a fertilized egg until the fetus or offspring is ready to be delivered. It is also called the womb. Its inner lining, the endometrium, known as this one, it undergoes seismic changes in response to hormonal fluctuations to prepare for potential implantation of a fertilized egg. During childbirth, the uterus contracts rhythmically to expel the baby through the cervix and into the birth canal. Now we will have our men explaining other parts.
So first or next is the fallopian tube. So the fallopian tubes connect the ovaries to the uterus, providing a pathway for eggs released from the ovaries. It is where fertilization typically occurs, and it is also known as oviducts. So the fallopian tubes are bilateral conduits between the ovaries and function as channels for oocyte transport and fertilization. It is basically where fertilization occurs. The next is the cervix. So the cervix is a small canal that connects your uterus and the vagina, and it allows fluids to leave and enter your uterus. So the cervix is a vital part of the female reproductive system, as it acts as a gateway between the uterus and the vagina. Its primary functions include allowing fluids such as menstrual blood and cervical mucus to exit the uterus and facilitating entry of sperm. During intercourse or fertilization occur. During childbirth, the cervix undergoes significant changes to prepare for the delivery of the baby. This process is also known as cervical dilation. It involves the gradually of widening and thinning of cervix to create a passageway for the baby to pass through during labor. We will now go back to Bernadette to talk about the external
For the external part, we now have the vulva. The vulva is consisting of the labia minora, and these other parts such as the clitoris, urethral opening, vulvar residue, and vaginal opening, and clitoral loop. So the function of the vulva is for protecting the internal parts from infection and allows sperm to enter your vagina for pregnancy. The vulva is situated externally at the entrance of the female reproductive system. Now moving on, we will have Corbin again explain the menstrual period for females.
So the menstrual cycle or the menstrual period. So the menstrual cycle, menstruation is a monthly of the lining of the uterus. So the menstrual blood, it flows from the uterus to the cervix and out of the body through the vagina. So menstruation is driven by hormones, and these hormones are chemical messengers in the body. The pituitary gland and the ovaries make and release certain hormones at certain times during your menstrual cycle. And these hormones cause the lining of the uterus to thicken. This happens so that if a pregnancy would occur, an egg can implant into the uterine lining. And the typical cycle lasts about 24 to 38 days. So that is all for our female reproductive system, and now we will be entertaining questions. Are there any questions? Yes.
What is ovulation and what stimulates it?
So ovulation is the release of a mature egg from the ovary into the fallopian tube, where it can be fertilized, and it is stimulated by a surge of luteinizing hormone, which is triggered by rising levels of estrogen during menstrual cycle.
Now we call on Nika to explain the common disorders for the male reproductive system.
The male reproductive system plays a vital role in the continuation of human species, and its proper functioning is crucial for the overall health of man. However, just like any other systems in the human body, it is also susceptible to various disorders that can impact fertility, sexual health, and overall quality of life. Here are some common disorders of the male reproductive system. First, we have the erectile dysfunction. Erectile dysfunction, also known as impotence, is the persistent or recurrent inability to achieve or maintain an erection sufficient for sexual activities. It is a very common problem among men past the age of 40, and it also affects 1 in 10 men overall. Most men with erectile dysfunction have a combination of physical and psychological causes. Next, we have benign prostatic hyperplasia, also called as benign prostatic hypertrophy or benign prostatic obstruction. It is a condition in men in which the prostate gland is enlarged and it is not cancerous. The cause of this is the enlargement is uncertain, but it is associated with aging, changes in testicular cell structure, and testosterone levels. Next, epididymitis. It is the swelling of the epididymis, often due to infection, and is typically caused by bacteria from a UTI or STIs like gonorrhea or chlamydia. It can also arise from E. coli linked to gastroenteritis. There are 2 types of epididymitis. First, we have the acute epididymitis. It is the invasion accompanied by pain or swelling. And the chronic epididymitis, it may occur with or without the bacterial infection, and it can last for more than 3 months and may last for years in some conditions. Next, we have prostate cancer. It occurs when granular cells of the prostate mutate in tumor cells eventually, the tumor, if undetected, a prostate tumor can invade nearby structures like seminal vessels. Its cells may metastasize through the bloodstream or lymphatic system, commonly spreading to bones, lymph nodes, rectum, or lower urinary tract organs. And it is a common type of cancer in males, but it is highly treatable in early stages. And lastly, we have testicular cancer. It forms when malignant cancer cells develop in the tissues of one or both testicles. It develops when cells multiply faster than usual, eventually forming a lump or tumor. A common initial sign of this is a painless lump or swelling in one of the testicles. While the lump may be or may not be painful, it can manifest as a sharp or dull ache in the lower abdomen or scrotum. Testicular cancer is most common in young or middle-aged men. So, do you have any questions?
How does depression affect erectile dysfunction?
Okay, so depression can contribute to erectile dysfunction by affecting mood, self-esteem, and the libido, as well as by altering brain chemistry and hormone levels, all of which can interfere with sexual function. Okay, so next, for the common disorders of the female reproductive system, Ms. Oni will discuss it.
So now for the most common diseases in the female reproductive system. Our first one is endometriosis. It is a chronic condition where tissues similar to the lining of the uterus grow outside of the uterus, commonly on the ovaries and fallopian tube and pelvic lining. So next we have the
fibroids and what symptoms may they cause?
So, uterine fibroids can develop due to various factors, but some of these factors include imbalancing hormones, genetic predisposition, and certain lifestyle changes, factors like obesity and diet. And symptoms of uterine cancer, uterine fibroids can include heavy menstrual bleeding, pelvic pain, pressure, frequent urination, and reproductive issues such as infertility or recurring miscarriages.
Okay, thank you.
We will now call on Maan to discuss the next.
Good day, everyone. Maintaining balik. Okay. Good day, everyone. So for today, we'll be talking about the healthy maintenance tips for both and short discussion of interactions with other systems. So maintaining reproductive health is important for both men and women. Here are some health maintenance tips for the male and reproductive systems, along with discussions of interactions with other systems. So let's start on with the interactions with other systems. So endocrine system. The reproductive system interacts closely with the endocrine system, which regulates hormone production and release. They rely on hormones such as estrogen, progesterone, testosterone, and follicle-stimulating hormone, or FSH. And glutathione hormone, also known as LH, to regulate various processes like ovulation, spermatogenesis, and the menstrual cycle. They are produced and released by the ovaries, testes, and pituitary glands of the endocrine system. Next, they also imbalance or any disruptions the hormones levels can cause a big impact in their reproductive system or the function, which can lead to infertility or sexual dysfunction. So this interplay between the endocrine and reproductive systems that underscores the importance of hormonal balance in maintaining overall reproductive health. Next, please. Now, in the nervous system, this is actually connected with the endocrine system alongside the reproductive system. So the nervous, endocrine, and reproductive system are tightly connected. With the hypothalamus placed this in the fray, playing a crucial role. It produces hormones that influence the pituitary glands to release reproductive hormones. Neurotransmitters and stress hormones also affect reproductive hormones procedures, or the production. Maintaining balance among these systems is vital for optimal reproductive health. Now, as we discussed already its interaction with other systems, let us discuss now the respective male and female reproductive system maintenance. In the male reproductive system, first, we regulate testicular node exams. Regular testicular node exams are essential for men to detect any abnormalities like lumps, swelling, or changes, which could signify underlying conditions including testicular cancer. Next, practice safe sex. Practicing safe sex, utilizing condoms during sexual activity significantly lowers the risk of contracting sexually transmitted infections, are also known as STIs, that can affect reproductive health. Men should also limit alcohol and tobacco use. Excessive alcohol consumption and smoking have been linked to decreased sperm quality and adverse effects on overall reproductive health. And lastly, healthy diet and exercise. Maintain a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular exercise can help improve blood flow to the reproductive organs and support overall health. Lastly, in the female reproductive system, we need regular gynecological exams. Regular gynecological exams, including pap smears, pelvic exams, are crucial for women to detect cervical cancer, sexually transmitted infections, and other reproductive health concerns. Next, we need to learn about birth control and family planning. Use sperm transaction consistently and correctly to prevent unintended pregnancies. Discuss family planning options with a healthcare provider to determine the most suitable method for your needs. Next, women should also maintain hormonal balance. Hormonal imbalance can affect menstrual cycles and fertility. Healthy weight management, stress reduction, and seeking medical advice for irregular periods or hormonal system are crucial steps in addressing these signs of hormonal balance that can impact fertility and menstrual cycles. Next, healthy lifestyle and choices. Incorporating a regular exercise, a balanced diet, sufficient sleep, and effective stress management techniques include one's lifestyle promotes optimal reproductive health and well-being. Lastly, women should also practice safe sex. Use condoms to also reduce the risk of STIs, which also can affect their reproductive health and fertility. To maintain good reproductive health and overall well-being, it's important to follow these steps to strengthen both men and women and understand how they affect other parts of your body. Regular checkups, and talking to your doctors are very important in spotting and treating any reproductive health concerns. So let's focus on incorporating these habits into our lives for a well-rounded approach to staying healthy. Thank you.
I have a question. Why should men limit their tobacco usage and alcohol intake? Like, what's the relevance to this to the reproductive system?
Thank you for that wonderful question. So smoking has also been associated with increased levels of aneuploidy in human sperm, lowered cellular plasma antioxidant levels, and increased oxidative damage to sperm DNA. So in addition, the chronic alcohol intake may also affect the male fertility by decreasing sperm volume, count, and motility, and by affecting morphology. Thank you.
Okay, guys, just to make sure that you learned something, we've prepared a quiz for you to answer for the rest of the class. It'll be quizzes, a live quiz. I'll be showing the top 3 performers. Let's get to it. Hey guys, we're starting that quiz. In 3, 2, 1. Oops, Mahesh.
What system is responsible for the production, storage, and transport of gametes, as well as facilitating fertilization and childbirth? In sexual reproduction, the female parent produces sex cells called when egg and sperm nuclei join, the egg fertilized create a The male parent in sexual reproduction produces sex cells called In the male reproductive system, what is the pair of organs that produce the sperm and testosterone? What is the main male sex hormone that is responsible for male characteristics such as deeper voice and facial hair? The tube that leads from each testis to the prostate gland and urethra is called In the female reproductive system, what are the organs that make eggs and the female sex hormones? What are the two main female sex hormones that regulate the release of eggs and production of female characteristics? What is the process called in which an egg is released for the ovary with the fallopian tube?
Okay guys, mana na to? Yeah. Ang leaderboard guys, naguna si Corbin, tapos si Greg, Maan, Anle, Erin, Mika, Bernadette. Thanks guys! Hi guys! Thanks again for joining us in our symposium. We are so glad that you can listen and learn with us as we discuss the reproductive system. We hope that you can join us in our next video. So remember to like, comment, and subscribe.